Hello, and welcome to our presentation on wearable tech in the healthcare sector. Today, we will be focusing on the Apple Watch and its impact on the industry and beyond. So today I wanted to start out by giving an overview of the Apple Watch and the healthcare wearable industry overall. So what is a wearable healthcare device? Well, basically, it's a device that is capable of tracking medically useful information. So some of the things that they can track are your steps, your exercise levels, your heart rate, and even your sleep schedule. And all of this is really intended to keep you more aware of your overall health and improve your quality of life. So recently, there's really been a lot of devices that's come into the market over the last few years, and they all kind of offer similar features. For example, Fitbits have traditionally allowed you to track your steps, but have begun offering devices that can track your heart rate and much more. This is mainly in response to Apple and their unveiling of the Apple Watch, which is a wearable smartwatch that allows plenty of health tracking. And in addition, the Apple App Store has over 165,000 health-related apps. So not only are developers creating these apps, they're continually creating these apps because there's a demand for it. So there's considerable demand on the consumer side, and people are using these apps, and people are enjoying these apps. Although, really the future seems bright for the healthcare wearables market, it's been kind of a slow start, and it's been a slow catch on, and is still early in its life cycle. Adoption of devices, which was initially very slow, has really ramped up over the last few years, especially those of the Apple Watch. They're really outpacing their competition considerably now. One of the main reasons is that they are investing in the right technology that consumers find most important. For example, they are the first smartwatch to engage directly with the FDA and seek approval for their new EKG function. Most tech companies have traditionally stayed away from dealing directly with the FDA, whereas Apple thought this would be a differentiator and decided to deal with them directly. And looking forward, there's unlimited potential here. The entire healthcare wearables industry, not just wearables, but healthcare wearables, is expected to reach $19.5 billion by 2021. So why purchase a medical device to track your healthcare? Well, it all boils down to patient care and quality of life. Diseases such as asthma, hypertension, diabetes, sleep apnea, they're all being tracked by wearers of the Apple Watch. Doctors view this as critical, as research has been done that suggests wearers of the trackable device are much more likely to track indicators that would lead to the disease worsening. So doctors are able to monitor, and they're able to offer valuable and often real-time feedback. In regards to rehabilitation, the Apple Watch is able to offer doctors insight into the recovery habits of recent patients. So delving into the history and development of the Apple Watch and the healthcare wearables industry, um, it really goes back much further than most people would realize. But I guess it depends on your definition of wearable healthcare devices. But if you consider a rudimentary drawing of a pedometer by Leonardo da Vinci in that category, then it really began in the 15th century. However, if you prefer a more conservative definition, then it kind of began in 2003 when the world's first fully digital pacemaker by Vitatron marked the beginning of what a healthcare wearable device is known as today. Fitbit, a very popular company based in California, kind of revolutionized how to track the number of steps that people take in 2009. And it really took over the market initially and was a major player in that category. People saw Fitbit as an easy way to track their health. by counting the number of steps that they take each day. However, in 2015, Apple was able to shake things up and introduce a smartwatch called the Apple Watch. With its recent iterations, it has introduced many features in one device that were previously only available by purchasing 2 or maybe even 3 products. This has allowed Apple to become the market leader in the category. So as we look back on Chapter 12 in our textbook and focus on software as a service, Apple is utilizing many of the key functionality associated with it. For example, many in the healthcare industry are already purchasing third-party software that is hosted elsewhere. The Apple Watch gives many in the healthcare industry another conduit to utilize that type of software. So by having watches on their wrist that connect to iPads or iPhones or any other iDevice, these nurses and doctors are able to access information quickly, reliably, and efficiently. Even companies such as Availity and Optum are utilizing the Apple Watch to allow seamless communication between the providers and the insurers. Apple, who develops and designs all of its products in Cupertino, California, is famous for having software that is an extension of the hardware. They've always been known for that, much more so than Microsoft, who mainly just controls the software that they've made. Whereas recently they've delved into the hardware market, but Apple was the first to do it. And the Apple Watch is no different, as Apple built the watch to work as an extension of the iPhone and kind of be one with the iOS, which is Apple's mobile operating system. This is key considering that Apple is able to work directly with developers and deliver the best in-house marriage of software and hardware. Furthermore, Apple controls 43% of the smartphone market, which is an indicator as to who would most likely purchase the device.
Relevant IT components. There are a few components which will enable Apple Watch to be effective in a healthcare setup. Number 1 is device, the Apple Watch itself. Number 2 is intermediary communication and processing devices. For example, iPhone, iPad, and on these iPhone and iPad, we will need apps which need to be added to these iPhone and iPad specific for these services. Along with this, internet service provider will be necessary, which will help to communicate with cloud or other services. At number 3, we have cloud services, servers, or patient data centers, which have archived patient data. This data, along with the data received from Apple Watch, is transferred to healthcare providers' database, just for example, Epic. Next component is hospital or healthcare provider data, for example, Epic. When data from cloud server and Apple Watch is received at provider database, just an example at Epic, it analyzes and auto-assess the situation and make a final decision. And this decision is real-time processing and real-time decision. The next step is final action. The final action may be taken in different ways depending on the situation. Just to give few examples, it may include drug administration devices which may be already attached to patient's body. Just an example, if Apple Watch detects that the sugar level is very high, the insulin device which has already been attached to patient data may inject insulin to the patient to reduce the sugar level. Another example may be if there is an anaphylactic shock, anaphylactic reaction in a patient, epinephrine may be injected to the patient to save the life of the patient. Another example would be communication or alerts to provider through their smartphones to alarm them or to let them know about the patient situation. Calling an ambulance or calling police as well. just depending on the situation. Here is an schematic example of this process. On the left hand side, we can see smart wearable devices user who are wearing these smart watches and the Apple Watch. They communicate through iPhone or iPads and using internet and apps. They transfer the data, the smart watch transfer the data to cloud, where the patient data is already, the previous archive data is already available. And through this cloud, all the patient data is transferred to Epic or the healthcare provider data, where real-time processing of this process occurs, and final decision of the situation is made and the action is taken. Here is another example of a different situation where this patient, the patient number 2, has high temperature, and the device which this patient is wearing detects that high temperature and communicates this information through the server to the provider. So the on-call doctor, which can be seen on the right-hand side of the picture, receives a message that patient number 2 has high temperature and alerts or alarm the doctor.
Some healthcare uses and implications for the Apple Watch would include the accelerometer and gyroscope in helping detect if the user needs emergency response within 1 minute of no response. This is a feature that helps in utilizing the GPS and recognizing if the user falls abruptly. Then it will notify the emergency responders to your location if you don't respond within 1 minute. This is important because, especially in cases where CPR is needed, within 4 to 6 minutes to avoid brain trauma, it would really help in decreasing that response time. And next would be the Apple Watch takes 30-second EKG instantly. This helps in giving a visual representation of your heart and seeing if it's healthy or not. Another thing that the Apple Watch uses is tracking all of the patient's information to one easy-to-use watch. Centralizing data for a patient can help in delivering better patient care overall.
On this slide are listed all the features of the most recent Apple Watch, the Series 4. For this presentation, I'll focus just on the health-related benefits, just to name a few. A new safety benefit to those with mobility issues is fall detection. If a fall is sensed, the Series 4 Apple Watch can be set to automatically call emergency services after 15 seconds pass without a response to a wrist-based alarm. The next new health feature would be electrical heart sensor. The Apple Watch Series 4 contains a built-in heart sensor, which is upgraded from prior series. It's designed to not only give you a pulse reading as before, but can now detect irregularities in the heartbeat. This is helpful for early detection on irregular heartbeats for users, and that early detection can allow wearers to seek a physician earlier. Finally, the combined improvement of the accelerometer and the gyroscope allow more accurate measurements for activity and workout training. This allows users who are running, swimming, rowing, using an elliptical, lifting weights, to get a more accurate reading of their movement, repetitions, as well as GPS tracking for outdoor running for distance. So we talked about the benefits of Apple Watch, which certainly make it an attractive piece of wearable technology. That same technology, however, does pose a couple major risks that stand out, and I wanted to talk about those risks today. Firstly, to obtain the full benefits of the Apple Watch, it's really meant to be worn virtually all the time, even overnight, for sleep detection. Studies have shown that RF, aka radio frequency waves, particularly in devices with cellular capability, has been known to cause cancer in adult rats. And certainly that causes an issue with the Apple Watch since it's in direct contact with the wrist for really long periods of time. Secondly, a similar risk to really all smart devices applies to the Apple Watch as well, and that's on the topic of security and privacy. The data that's transmitted often uses, let's say, a public Wi-Fi network for transmission, and that info could be easily intercepted on a network that's not encrypted, which really makes accessing any public Wi-Fi areas a real area of concern. So, like any smart devices, privacy, breaches, security, always a major risk. On the topic of risks of Apple Watch comes what some might consider another downside, which is the high price, even for the more dated series of Apple Watches. The Series 3 option, which is the oldest version that Apple sells directly, if purchased new and with the most basic features, still ranges in around the $270 to $280 mark. The newer Series 4, with just the very basic options and features, starts at around $400. All those prices, of course, go up if the wearer decides to add cellular or other more attractive features. So for those wearers of Apple Watches who wish to have the technology and add a more stylish or trendy watch band, can quickly take the price up to close to $1,000, maybe even more. So needless to say, the Apple Watch is not the most economical smart watch or smart device, but like most Apple products, it does appeal to its niche market, which is higher quality and brand name.
Future trends of the Apple Watch in healthcare would be tracking of sleep cycles and sleep apnea detection. So with the Apple Watch, you could be it could detect potential sleep apnea in a person. Sleep apnea is when you're sleeping and the upper airway becomes blocked, reducing or completely stopping air to the lungs. This can cause complications with type 2 diabetes, high blood pressure. So the Apple Watch could definitely be used in detecting that. Another future trend would be Parkinson's disease monitor. Parkinson's disease is a brain disorder that leads to shaking and stiffness and difficulty with walking, balance, and coordination. It affects 1% of people over 60, and it would help in being able to detect these tremors in these people or early detection of these symptoms. Another way that the Apple Watch could help in the future in healthcare would be glucose monitoring or diabetes maintenance and tracker. Diabetes is affecting more than 100 million U.S. adults every year, so it would be a good thing to detect high glucose levels and to avoid shock and other implications that it could bring.